Well, I'm joined now by Dr. Ramon Pacheco Pardo, a reader in international relations at King's College in London. Do you think it is wise to go on ahead with this election?
I think it was. It would have been very difficult for Korea to postpone elections. It is a very young democracy. It only held the first free elections in 1987. So the president, even thinking about postponing the elections, would have been seen as a possible step backwards in the democracy of South Korea.
And do you think that he has got public support, the president, for the way that he has handled the crisis, given the ability that South Korea has had to stamp down on the spread?
I think he has. Before the pandemic hit South Korea, his approval rating was 45%. Over the past couple of weeks, it has been 60%. And it seems that his party is going to win an outright majority in the National Assembly, which it didn't have. So I think he clearly has the support of the population of his country. And I also think that the way he handled the coronavirus crisis was the main reason why his support has been going up in recent weeks.
Why was South Korea able to do this? How were they able to do it?
Well, they had a couple of bad experiences. In 2015, with the MERS outbreak, South Korea had the second largest number of deaths in the world. 2014, there was the sinking of a ferry, and many people died. So they had these past experiences, bad experiences, and they learned from them. They learned that they had to tackle the outbreak as soon as it started to come out of Wuhan, of China. And that's what they did. And I think that the thing they have done is they have been very open with the public about the measures that were going to be taken, why they were going to be taken, and at what point they might be stopped.
But in terms of physically being able to do it, how much is the biotech industry and the strides that has made in South Korea been responsible for what they've achieved?
Well, this is quite important. South Korea has a strong biotech industry. The government has been investing in this sector going back to the 1990s. So this is a 30-year process. If we look, for example, at the tests that South Korea is starting to export to Europe, to the US, to other parts of the world, there has been government support throughout this 30-year period, and especially since the MERS outbreak, there has been a big emphasis on how to improve testing capacity. And we have seen this successfully deployed during the current coronavirus crisis.
It's not something that other countries can really pick on quickly enough, is it?
Not quickly enough, but it's something that can be done over a number of years. Maybe not for next year, in a couple of years, but in 5-10 years, if we see another pandemic hitting the UK, the rest of Europe, the US, it should be possible to build this capacity because South Korea was able to do it. It is a wealthy country, but the UK, other European countries, as wealthy or more than South Korea. So they could try to do it, definitely.
How much of the success has been down to having a relatively compliant population who listen to what they're told to do and follow instruction?
I think more than compliance, it has been openness, because we shouldn't remember that the government came to power after the previous president was as a result of a popular revolution, so to speak, with demonstrations on the street. I think openness has been much more important. I think that the current government had tried to hide the fact that the coronavirus had reached South Korea, then we wouldn't have seen much compliance. I think we have seen some revolt in the streets, actually, and some demonstrations in South Korea.
OK, we will leave it there. Dr. Ramon Pacheco Pardo from King's College London, thank you very much.